welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwarz, licensed midwife and one of the MCs here at Gold. And with me here is Dr. Alexandra Glass. Welcome, Alexandra.
Hi, thank you for having me.
It's wonderful to have you back. You've been with Gold before as a
Yes.
speaker, and you are with us for our Gold Lactation Online Conference 2026. You're part of an add-on package, and your presentation is titled Lactation Related Abscess, Assessment and Clinical Management. I can't wait to talk to you about that. But first of all,
Yeah.
Alexandra, where are you in the world? And tell us a little bit about your background.
I'm in Hanover, Germany. That's in the north of Germany. Yeah, there's snow outside right now. I'm working as a obstetrician and gynecologist in private practice now for I've been an OBGYN for more than 20 years. I'm in private practice in an outpatient setting for more than 10 years now. And yeah, I'm also in IBCLC since 2009. So that's 17 years now. I recertified not long ago.
Fantastic. Well, thank you so much for sharing that. I think it's such a wonderful combination, OBGYN and lactation consultant. I think that fits so well together for
Yeah.
your practice, right?
Yeah, definitely. Yeah.
It's now with regards to the topic, you're going to be talking about lactation related abscess, and tell us a little bit about this topic. Breast abscess, in the content of lactation, what assumptions do you think some of, the fellow IBCLCs may have when that topic comes up? And how these assumptions maybe also guide us the wrong way when we look at abscesses. Tell me a little bit about that.
Yeah. Abscesses are, it's quite a medical topic, I think. So if you have engorgement or mastitis, you will usually start working on that at home conservatively. That's the right way to do. But abscess mostly being or very often being a complication of mastitis, lactational mastitis. So for me, working in a more medical setting, that's often when I take part in the treatment. So either if I'm treating the mastitis because somebody needs antibiotics, or if they already present with an abscess as a complication. Yeah.
Absolutely, yes. So abscesses, as a part of, you're talking about mastitis there as well. Are there any early warning signs that are missed that it develops into the abscess? Is there something, that you would recommend doing sooner? Because when you're working with your clients, it's probably already in a, more developed stage. So tell us a little bit about that.
Yeah. First of all, never. I want the patient not to feel bad for maybe like coming too late. I'm never gonna say, why didn't you come sooner or anything, because that's not gonna help.
Right.
And sometimes it just happens, Of course, it's possible that if mastitis is not treated correctly, that's a risk factor for the development of an abscess, but it sometimes just happens. So when I see the patient, I'm just going to assess and then start from there. What can we do to, of course, relieve symptoms? What can we do to get rid of the abscess?
Right.
And of course, what can we do to to support lactation, to support continuing breastfeeding or chest feeding,
Right.
because that's what most of the patients want that contact me. Of course, it's always okay if you had like a difficult journey
Mm-hmm.
until then, and they don't want to continue breastfeeding. That's totally okay, and I respect that, and I will help them with that too if it's
Mm-hmm.
wanted, of course. But usually we first treat the mastitis, we first treat the abscess, and then we'll talk about weaning,
And
because it's most of the cases not helpful to combine the
yeah.
treatment of the abscess with weaning at the same time.
Mm-hmm.
And it's not because I want to like make them
Right.
breastfeed longer or anything. That's not my
Right.
intention, but that's usually a reasonable timeline to treat the mastitis and the
Yeah.
abscess, and then wean if you want to. And
Absolutely.
some still want to wean afterwards, and some say, okay, now I can go on, but that's
Yeah.
totally
Yes.
up to them.
Yes, now I can go on. Yes, and speaking of, the, the abscess is obviously incredibly painful, right? Um,
Hmm.
but also, I feel like there's a lot of emotional factors involved.
Yeah.
I mean, the birthing person, the lactating
Mm-hmm.
person is in pain. You want to bond with your baby. Milk supply, if feeding
Mm-hmm.
wants to continue with breastfeeding, they are probably very worried about that the milk supply would be compromised.
Yeah.
How do you work with your clients in that way?
Yeah. Um, Usually, if of course, like milk supply is often a concern, but if you enable them to make informed decisions and explain that it's absolutely possible that milk supply can like get less for a short period of time, but it can get that can resolve the situation, can resolve later. You can uh, yeah even if on one side the milk supply is getting less, you can make it come back later.
Hmm.
That's almost always possible, especially with the right treatment for an abscess, and that's something many people don't know in
Hmm.
my experience. They don't know that it's possible that the milk supply just gets less in one breast. Most people always assume that it's on both sides, but
Hmm.
often but the breast can regulate that independently. So that's a relief for most of them, and also that you can you can relactate if you
Yeah.
even if you
Hmm.
stop if you weaned if you stop breastfeeding. In many cases you can relactate, and that's something that is also not quite known. So
Right.
I think information is the key, and taking the stress, the pressure out of the situation, that also helps with
Hmm.
getting better sooner, and
Right.
we usually can handle that quite
Yeah.
well then.
I love what you said there about information is key, because knowledge is so important,
Yeah,
as you said about the what is not much known about relactating and
yeah,
that the milk supply can be reestablished.
yeah.
That is very helpful information for these
Mm,
parents because, they're obviously very worried about that as
yeah,
well. Yeah.
yeah. And there's so many wonderful um, aspects to lactation, what the tissue can do, what our bodies can do. So it can be it can be empowering to
Yeah.
get to know that and to learn about what our bodies can do, what our
Hmm.
bodies can manage. So yeah, I love talking about that because
It's,
yeah, it's just it's a great thing, and it can be empowering, even
yeah,
if mastitis can be a bad place to be, of course.
right. Of course. But with the information, it can feel empowering that you're not um, there is hope. There's something can be done, and
Yeah,
it's
yeah,
not the end of breastfeeding. I
no,
absolutely love that. And yeah,
no,
our bodies are amazing when it comes to
yeah,
that. Now, you're an OBGYN, so you
hmm,
can prescribe antibiotics, you can puncture,
yeah,
you can,
yeah,
do that. Now, our, IBCLC, that would be, of course, out of scope of practice for them.
yeah,
So, what do you recommend for the IBCLCs who are watching your presentation? What can they
yeah,
take with that into their practice?
yeah. First of all, I would like to be every OBGI to every OBGYN to be a lactation consultant, of course. Um, yeah. Um, of course, I know it can be difficult. Hanover here is it's a city with 500,000 people living here. I don't know how many OBGYNs we have here in outpatient settings in private practice, because that's just how the health system here is built off.
Hmm.
That can be different. Of course, that is different in other regions of the world. And I am the only OBGYN in private practice who is also
Hmm.
an IBCLC. So midwives, other IBCLCs, all the people that are taking care of families in the postpartum period or during lactations. During lactation, they often send them to me. It's not always that they are my patients that I have
Right.
been treating like for years, but they often come to me with specific um, uh, questions,
Right.
situations, symptoms. So if possible, try to find someone to work with, find
Hmm.
someone to refer to,
Right.
and of course, an abscess is a complication. So
Right.
start with the treatment of engorgement. How
Hmm.
do I treat engorgement?
Hmm.
How do I treat mastitis? You don't always need antibiotics for mastitis. If you treat mastitis the right way early, you can
Hmm.
prevent many abscesses. I'm sure, and in some cases it's a complication that can happen,
Hmm.
but there's a long time before that, and where you can have quite an impact.
Right,
So
right.
yeah.
I love what you just said. It's number one, again, information is key. Get educated on the topic.
Mm,
Know what's doable, with your
mm,
presentation, you will
yeah,
show that. Make connections in the community,
yeah,
find maybe other
mm,
OBGYNs that are,
mm,
either if they're not IBCLCs
mm,
themselves, but breastfeeding
yeah,
friendly
yeah,
or
yeah,
supportive rather.
mm,
And, and start early with mastitis and
yeah,
know your skills, and
yeah,
a lot can be done. Oh,
yeah.
that makes me really happy to hear. Well, thank you so much, Dr. Alexandra Glass. It was lovely to have you back here and at Gold, and I'm really looking forward to your presentation titled the about the abscesses and the clinical assessment and clinical management of lactation related abscess. Thank you so much for being here with me today as well.
Thank you.
And now I have some information for our viewers. If you'd like to find more about this presentation and all the other presentations in the add-on package, as well as the Lactation online conference. And this is our 20th anniversary. Believe it or not, this is for 20 years we've been putting on this amazing conference. So we invite you to go to goldlactation.com. You'll find all the information there. We have 2 open access keynote presentations that are available. You can watch absolutely free of charge. Make sure you share that with your friends and colleagues in the field. And I hope to see everyone at the conference. Thank you so much for watching. Bye bye, everyone.